Well, we're going to get started now. I want to say again, welcome to everyone. Thank you for joining us today. My name is Jessica Martinez, and I serve as the co-director for the National Council for Occupational Safety and Health. It's National COSH for short. And I work with a passionate team and network of health and safety activists from across the country. And I really want to say thank you to everyone for being here with us. Mi nombre es Jessica Martínez y sirvo como codirectora del COSH Nacional, que representa el Consejo Nacional de Salud y Seguridad Ocupacional. Somos COSH por sus siglas en inglés. Trabajo con un equipazo muy apasionado de activistas y trabajadores líderes por todo el país dedicados a la salud y seguridad para todo trabajador. Les quiero agradecer mucho por estar con nosotros aquí en esta reunión pública. Es muy importante tener su participación. Just a reminder that today's call, as most of our programs are bilingual in English and Spanish. We are going to have English and Spanish commentary and questions from speakers today. So if you don't speak both English and Spanish and are a monolingual speaker, do not worry. In a moment, you will see a globe at the bottom of your screen and an announcement saying interpretation is available. When that pops up, choose English. If you're a monolingual English speaker. And if you are in your smartphone with the Zoom app, you may have to go into the three dots icon to find the globe or the words language interpretation. Antes de comenzar, queremos que las personas sepan que participaremos en inglés y español. Si no habla inglés y español y su idioma es en español, no se preocupe. En un momento verá un globito en la parte inferior de su pantalla y un anuncio que dice que hay interpretación disponible. Cuando le aparezca, elija español. Si está en su teléfono inteligente con la aplicación de Zoom, es posible que deba ingresar al icono de 3 puntitos para encontrar el globo o las palabras language interpretation. If you have any issues, we really don't want you to be suffering in silence. I want to let everyone know that you can write in the chat to my colleague, Jessie Cruz. And if you cannot find that chat, let us know with your voice. Si tiene algún problema, no sufra en silencio. Escríbalo en el chat a nuestra compañera Jessie Cruz y le vamos a hacer todo lo posible para ayudar. So with a quick show of thumbs up, can we confirm that you can hear the interpretation today? Can you hear it? No, está funcionando la interpretación. I don't see. I'm not sure if that means we're not quite connected.
I haven't heard anything.
No.
In the English room.
Hello, this is the interpreter. Can you hear me in the English?
Now I hear
Yes,
you.
we can hear you now.
Okay, if someone could. We're good on the English. If someone could go into the Spanish.
Interpretation.
Yes, I can hear it.
Wonderful.
Yes.
Jessie, can you just confirm with your voice that we're set?
I don't know how to do the thumbs up other than saying it verbally.
So wonderful. So just again, just a reminder to folks, if you're wondering how to access interpretation in your Zoom profile at the bottom, there's a little globe that says interpretation. If you're a monolingual English speaker, you click on that, you click English, and you will start to hear interpretation if I'm speaking in Spanish. So si está hablando español, lo va a escuchar. De nuevo el globito que está abajo de su pantalla para escuchar la interpretación. Let me give folks a couple seconds to do that. Francine, I'm sorry, say that one more time.
Click on the English version, but it's not letting me through.
Okay. Jessie, maybe if you could work with Francine. Everyone else, are we okay?
Okay.
With interpretation, ¿nos pueden escuchar? Okay. All right, sounds good. Thank you
Ese
so
está
much.
bien.
Thank you. So again, if everyone could please mute your phone, we're gonna do a little overview of today's agenda, which is going to be very important for us today. I can ask Marcy if we can go to the next slide. And again, if folks can mute themselves, that'll be important to avoid any background noise. So we organized this town hall as the first of many dialogues with the twin goals of gaining an understanding of the values and priorities of the Occupational Safety and Health Administration, or OSHA, under today's leadership, and to put forward workers' concerns and priorities. We'll begin with an overview and opening remarks from Jim Frederick. Then we'll proceed to commentary, questions, and answers from several workers, leaders, and advocates representing different industries from across the country. After questions and answers, we will close with next steps and commitments. So I want to just make sure folks understand that we will have a busy agenda, and at the end, we will be taking notes to remind folks of next steps and commitments. So next slide. So it's amazing to see many workers and advocates with us here today. Many of you are looking for answers and a renewed commitment from our government officials that worker lives matter. Some of you may be new to this space, and we are seeking an opportunity to learn and connect. So let me tell you briefly who we are in case you're new to National COSH or this network. National COSH and our 25 local COSH affiliates and our broader network, the Protecting Workers Alliance, are dedicated to building the power of workers to assert their right to earn their living with respect and be free from harm and abuse. We do this through leadership development, education, organizing, advocacy, and most importantly, taking action. Our guiding principle is that workers who are essential should be essential partners with employers and with policy and decision makers. For the last 4 years and throughout this pandemic, workers have labored with zero of the federal protections they urgently need. Instead, they turn to each other and the COSH network to take action at the local and state level. Together, we supported workers across the country organizing for their lives by developing resources so workers could assert their right to earn their living without the daily threat of becoming ill and putting their families at risk. While states across the country are moving far too quickly to halt COVID-19 safety measures, workers are still at risk right now. This pandemic, which has killed over 600,000 people in the US so far, is not over. More than half of the US population is still not vaccinated, and many, many frontline workers are included in that list of not being vaccinated. After ceaseless organizing by workers and advocates, on June 10th, the Biden administration finally announced a COVID-19 emergency temporary standard, or ETS, for healthcare workers. Healthcare workers who saved our lives deserve these protections, but so do the meatpacking workers, farm workers, and millions of other frontline workers who put their health at risk every day. Though OSHA under Jim Frederick's leadership proposed a broader COVID measure to protect all workers, the White House has failed to take action. We are angry. Millions of workers are unprotected, and we will continue to urge President Biden to follow through on his promise to keep America's workers safe. Workers are voicing their concerns and meeting with the regional OSHA representatives to bring forward their priorities and concerns and insist that their safety rights are enforced and protected. Our network firmly believes that together we can still turn this around, save lives, get healthy, and get back to work in an environment with greater safety precautions and lower risk. In early February, our network of workers, labor and community organizations and safety advocates developed and released the National Agenda for Workers' Safety and Health to the Biden administration. This cover right here may look familiar to you. We will be sharing the link with our agenda points through chat right now, which is available in English and Spanish. And the central demands include strong protections that are accessible to all workers, halting retaliation, including working in collaboration with any other agency that threatens the livelihood of workers, such as Homeland Security or ICE, bringing workers to OSHA's table so they can bring their firsthand knowledge to all policies and protocols, and confronting the effects of heat, storms, and other climate emergencies on. So again, I invite you to take a look at this agenda. We're sharing the link in both English and Spanish. We have shared it with OSHA and with several other political representatives across the country. It's important that you become familiar. We will hear some of these themes highlighted today through different commentary and questions. But now I'd like to introduce the Acting Assistant Secretary for OSHA, Jim Frederick. Jim has 3 decades of experience providing occupational health and safety leadership to North American labor unions as an advocate and a resource to workers, their employers, and regulatory agencies. He spent 25 years in the Health and Safety Environment Department of the United Steelworkers Union, USW, serving as Assistant Director and Principal Investigator until 2019. In that role, he provided technical guidance to the USW and other unions on matters pertaining to occupational health and safety. I'd like to now invite Jim to provide some opening remarks. Jim, are you there?
I am. Is the audio okay?
We can hear you.
All right, very good. So first and foremost is a big thank you. Jessica, thank you for the invitation. Marcy as well, and everyone involved at National Kosh, thank you for the invitation. And thank you everyone who is on the Zoom call today for participating. It is really appreciated that you are here and willing to share your experiences and concerns, because we truly want to both hear and learn from them. We believe at OSHA, and we know that workers are the core of OSHA's mission. Everything that we do, every standard that we put out, every inspection that we conduct, and every publication that we produce is with the goal of protecting workers from health and safety hazards on the job. And I also just want to start by pointing out that there are a number of people from OSHA staff that are with us on the call today. And I know if I try to name everyone that's on the call, I'll miss several, but there are several people both from the national office at OSHA involved with rulemaking, involved with enforcement, involved with the overall guidance of the agency. And there are also many people from OSHA who are on the call today from our regional and area offices, including a number of the OSHA labor liaisons who are on the call with us today. And so, you know, also a big thank you to all of the OSHA staff, both who are here and those that aren't here, all of the ongoing work that we continue and that we are going to continue this work with National Kosh organization to increase and make our communications better, and also increase our relationship and make sure that we're building as we move forward. So just a few other points I wanted to start out with, that as many of you may know, this is the 50th anniversary for OSHA since OSHA opened its doors in 1971. And while workplace safety improved in many workplaces over that half century, we also know that there's so much more work to do, because there are still far too many workers that are injured, made sick, or killed at work where that injury or illness could have been prevented. And this is why OSHA's mission is so important. And Jessica, as you laid out in your opening introduction, there is much work to continue to do around the COVID-19 pandemic. And as the pandemic has highlighted, the OSHA mission is as important now as with any time in OSHA's 50-year history. Too many people in this country have died from COVID-19 for simply doing what they had to do to provide for themselves and their family. The science tells us that healthcare workers, particularly those who come into regular contact with people who are either suspected of having or being treated for COVID-19, are the most at risk currently. And that's why the emergency temporary standard is focused on healthcare settings and is tailored to cover the workers most likely to come into contact with someone carrying the virus. This includes hospitals, nursing homes, emergency responders, and other high-risk areas in healthcare settings. Throughout the pandemic, healthcare workers in these settings continue to be the source of the highest number of complaints that OSHA has received and continues to receive. Information about the OSHA emergency temporary standard, including fact sheets, frequently asked questions, and other compliance assistance materials are available on the OSHA website at osha.gov. I certainly hope that you've had a chance and continue to have some opportunity to look over those materials on the OSHA website. In addition to the healthcare-focused emergency temporary standard, OSHA also updated our January guidance in line with the latest science and shape of the pandemic to help employers and workers in other industries protect workers who are still not vaccinated. The updated guidance is also available on our website. Please take a look at it and share it with others. We really need your help to reach audiences that we might not otherwise have reached with what is on our website currently. Of course, the pandemic is still evolving, and OSHA will continue to monitor vaccination progress, virus variants, and other factors that will guide our continued efforts to ensure that workers are protected from the virus while they are on the job. In addition to the emergency temporary standard, OSHA has other regulatory activities in the works. The spring 2021 regulatory agenda reflects the administration's priorities with a renewed focus on improving working conditions relating to workplace safety and health. OSHA has added some new items to the regulatory agenda, including a rulemaking on heat illness prevention in outdoor and indoor work settings. It's important that as we take steps to address the pandemic and a myriad of other hazards facing workers and workplaces, that we are fully engaged with all of our stakeholders to address their needs, to share their good practices, have them help us share information about the resources that we have available to that we may not be able to reach ourselves. It's also important that every worker knows about their rights and is empowered to speak up about health and safety concerns in their workplace. And every worker must be provided training in a language that they understand. It's important that we are reaching all workers. We know that too often many workers have been left out or forgotten due to their citizenship status, because English isn't their first language, or because of the color of their skin. Too often, these workers are not aware of their rights or feel uncomfortable raising safety concerns. As you well know, these workers are entitled to the same protections as anyone, and we have to do everything in our power to make sure that they get them. OSHA will work with all of our stakeholders to address these issues surrounding diversity, equity, and inclusion. I also want to mention that last week we announced the availability of $10 million for the Susan Harwood Training Grants programs focused specifically on infectious diseases, including COVID-19, and that this funding is available to OSHA through the American Rescue Plan. This funding opportunity is in addition to the more than $11 million in FY 2021 Susan Harwood training grants that were also announced last week. Applicants are allowed to apply and receive both an infectious disease grant and a regular 2021 Susan Harwood training grant. Due to the federal holiday that took place last Friday, June 18th, the grant funding opportunities showed up on the website link as withdrawn from the Federal Register, but the grant funding opportunities are not withdrawn. They are available and will be republished tomorrow in the Federal Register. And so the information is available on our webpage, OSHA.gov, about those opportunities. And please, again, check on our website, look at those funding opportunities, and we hope that folks that are involved with this conversation today are able to consider applying for some of that grant funding. So just a couple of thoughts in closing before we get to some questions and conversation. Thank you again for inviting me to join you today. I want you to know that we are committed to reestablish strong relationships with the national and local COSH groups. We look forward to meeting on a regular basis to address your concerns and to build trust so that workers know OSHA is here to protect their rights as well as their safety and health. I'd now like to hear more from you and address some of the questions that you may have.
Thank you, Jim, so much for that overview. We really appreciate all that you do and really appreciate your outlining the resources available right now to several of our advocates and worker leaders here today. Just a quick reminder to folks, if we could slow down a bit and speak at a moderate pace when you are providing commentary and questions so our interpreters can capture it all, that would be really great. We are now going to move into the section of commentary with your support, Jim. What we're going to do is we know that several folks in this town hall here today have expressed interest and have many questions, commentary to share regarding their own local regional experiences with OSHA or their efforts to educate or exercise worker rights around workplace health and safety. However, we don't have the opportunity at this moment to take all questions. What we're going to do is we have selected a couple of folks who have already put their questions out. We will then do some follow-up work with Jim to ensure that the questions that we are not able to take today, that we will provide that follow-up and answers. So with that said, I'm going to now invite Alex Sanchez, who is an organizer, worker advocate with the Los Angeles Garment Workers Center, who has his first commentary and question. Hi, Alex, you there?
Yes, good morning, afternoon. Thank you for the invitation. My name is Alex Sanchez. I'm the field organizer with the Garment Workers Center in Los Angeles, but also a member of SoCal COSH. As a pandemic ravaged our country and workplaces, garment workers in LA were really heavily impacted while sewing masks and gowns for frontline workers. The garment industry lacks the basic safeguards for heat illness, ventilation protections, and overall health and safety that were magnified during the COVID-19 pandemic. Most garment workers in LA work in modern day sweatshops. With the support of SoCal COSH, the Garment Workers Center has been on the forefront of supporting workers by filing complaints with public agencies. This year, the Garment Workers Center is working to eliminate a huge barrier that garment workers face, which is wage theft. Championed by Senator Maria Elena Durazo, California Senate Bill 62, if passed, garment workers would not be bound by a piece rate that has contributed to their workplace safety due to productivity standards and also repetitive movement injuries. But also the brands and manufacturers would be held responsible for the sweatshop conditions that they help create. Unfortunately, we still have many barriers. The problem lies with short staffing, with local enforcement, and also trying to navigate between the different entities who are responsible for workplace health and safety. We need national policies in place to protect not only garment workers in LA, but the millions of workers in the US. One death in the workplace is one too many. Unfortunately, businesses still choose profitability over worker safety. I want to ask you, Jim, what would you do about streamlining the process so all agencies are working together? Thank you.
Thank you so much, Alex, for your comment and question. I'm going to now invite Julia with the Western North Carolina Workers Center to provide a question and a comment and question, and then Jim will have you respond to both if that's okay. Julia, buenas tardes. ¿Está con nosotros?
Muchas gracias. Hola,
Julia. Julia, hi. Good evening. My name is Julia. I'm sorry. And I work in a chicken processing plant in Western North Carolina. And I'm also a member of the Workers Center in Western North Carolina. I wanted to share that even before the pandemic, the folks that work in these poultry plants, we have been working under dangerous conditions and unhealthy conditions. The speed of the lines is dangerous for the workers. And we working in close places with no ventilation, and that has always been a problem. For us, the workers, for many years, these problems have been increasing during COVID-19. And really, us poultry workers feel like very isolated and alone and abandoned. And now that, and because the state and federal government has not taken the measures, the adequate measures to demand that the companies protect the workers. And so I have a question for for Jim. What measures can OSHA take to protect workers and these fact from the resulting payback when people make complaints? And can you guarantee that immigration is not collaborating with OSHA when a worker puts in a complaint? Thank you, Julia, for your comment.
Question, Jim.
Sure. So first, thank you both, Julia and Alex, for the questions and your thoughts throughout that. I really do appreciate it. And just one, I wanted to start with both of you, although I know that we are here in the context of people from all across the country, but in both North Carolina and California cases, we also want to make certain that we outline and highlight the fact that roughly half of the states, including both North Carolina and California, have their OSHA coverage with a state plan program. And again, both states having their state plan program for some of the specific items. I can speak to the federal OSHA process more generally, but there may be some nuance that we will have to discuss further with the state plan. And so to maybe perhaps start with Julia, at the end of your question, the interpretation came through as what could we do to protect workers from payback, but I think, is it better to use retaliation? Was that the word that was trying to come through?
It was retaliation, yes.
Okay.
Retaliation,
okay.
And also ensuring that agencies such as the
Yes.
ICE will not be collaborating with OSHA. Mm-hmm.
Yep. So one on the front of retaliation to workers for exercising their rights under the OSHA Act. OSHA remains very much committed to work with all of our field staff across the agency and ensure that we are doing everything we can in the scope of the act and within the other whistleblower protection acts that we have the authority to represent workers on. And we are working diligently to both provide more staff to the whistleblower protection portion of OSHA and work on a number of items to increase the efficiency of the process to make certain that we not only are getting through those cases in a more timely manner, but also trying to also assure everyone involved that we are getting through those cases in a way that is reflective upon what should be the outcome to look into whatever the retaliation may have been and come to the result that we are able to through the process that we have within the OSHA system. And then the second portion of the question from North Carolina, OSHA has been, I mean, back up to January 29th, just a few days after I started this work with OSHA, there was the horrific event in Gainesville, Georgia, nitrogen leak at a chicken processing facility, and a number of workers, 6 workers, were fatally injured as a result of that leak. We have been working diligently on a number of items to make certain that at OSHA, we do not want any concerns about immigration being part of an OSHA inspection. And we are working diligently with our partners at the other agencies and the Department of Homeland Security on that front, and we'll continue to do that as long as we are here doing this work. Also, just an important point as we talk in this, talking about this from my perspective, but it's really important to understand that from within federal OSHA, the almost 2,000 people that work for OSHA have all been and remain very much committed to all of these items that we're talking about today. This is not something that just started. The people that work at OSHA are truly committed to advancing and improving workplace and worker health and safety, and will continue to do that. And then last point on Julia's question from North Carolina, we have been and will continue to try to work as closely as possible with the state plan OSHA programs to make certain that what we're doing on the federal level is shared with them. They will know it, they will understand it, and we'll continue to work to make certain that the letter of the law, that the state programs are at least as effective as are true and something that you see in your workplace and workplaces in any other state plan program. So with that, maybe I can flip over to Alex to your question a bit on streamlining the process. I hear you, and I understand that working through the various portions of the support network that is available from the federal government, the state government, regionally is a challenge and difficult. And one of the things that we have been doing since I arrived at OSHA is working with our counterpart agencies within the Department of Labor to make certain that we are in close and good communication. So the example that you raised around some of the wage issues, that we are having frequent and ongoing dialogue with the leadership at the wage and hour division of the Department of Labor to try to alleviate some of that confusion that comes into play between the different parts of the Department of Labor. And so we're working on that. And again, this is not new. This is something that the folks who, excuse me, have worked at OSHA for years and years have been doing with our counterparts at the other parts of the federal government. And we're continuing that process.
Thank you so much, Jim, for responding to that. I just wanted to flag for folks that in regards to your earlier point, which is a big concern in particular in work areas where there's a big population of immigrant undocumented workers. If OSHA can proactively work to revive the MOU between the Department of Homeland Security and OSHA to ensure that commitment is twofold, coming from both OSHA and the department in the future. So I just wanted to flag that and see if any thoughts regarding that.
Yeah, well, and if I could just also just one other important point for specifically for people that are working in the various chicken processing, pork processing. We have also been engaged and very actively in conversations with the Food Safety Inspection Service from the USDA about a number of issues pertaining to workplace health and safety. And there has been an existing memorandum of understanding, memorandum agreement, sorry, I can't remember which term it is, between OSHA and FSIS, and we are currently working on a revision to that to both reaffirm the work within the Food Safety Inspection Service and OSHA, and also try to make some improvements on some of the portion of that work that we are doing moving forward. And so we, again, we're doing some of the same. The Department of Homeland Security and having those conversations about how we make certain that the trust that we need to earn as OSHA is that when OSHA is at a site performing the work that we do, it is OSHA. It is not anything to do with immigration. And we need to earn that trust and earn it one inspection at a time and make certain that we hold that bar very, very high.
Thank you. Thank you so much, Jim. All right, we're going to move on to our next comment and question. I'd like to invite Francine Bailey, who is a nursing home CNA. She's with SCIU 1199 New England, who's also a member of Connecticut. Francine, are you there? Can you unmute yourself, Francine? We can't hear you.
Okay. Can you hear me now?
Yes, thank you. Go ahead, Francine.
Hello, good afternoon. My name is Francine Bailey. I'm a certified nursing assistant at Genesis Healthcare in Bloomfield, Connecticut. Last year, when I was working, COVID-19 arrived at my facility in March 2020. I myself and thousands of nursing home workers around the country were denied proper PPE, staffing, and safety in the job. At my facility, when COVID-19 arrived, patients, the administrator at the nursing home used N95 masks and full body suit. Yet at the same time, we denied the use of simple surgical masks. One of the largest issues during the pandemic was, sorry.
That's okay.
This is very emotional for me.
I understand.
The patients at the nursing home and administrator use N95 masks and full body suit. Yet at the same time, we even were denied simple surgical masks. One of the largest issues during the pandemic was that not just getting the PPE supplies at the nursing home. It was at the management that holding the supplies and refused to let staff have access to PPE. I got COVID-19 at the time and brought the virus home. Like the nursing home workers around the country, where I was ignored because we were women and predominantly Black and brown. OSHA also ignored us. Even though we lost we lost 2 co-workers in COVID-19, there was no one on the ground. OSHA ignored us to hold for-profit employee accountable during the considering me and my co-workers were working in. The lack and the acknowledgement. The lack of accountability allowed thousands of nursing home workers just in my state of Connecticut to get sick. And we have 2,000 members in the long-term care who died from COVID-19 caused at work site. When our patients were getting sick and dying, when we were getting sick and dying, when our family members were getting sick and were dying, and our union representative contact OSHA and asked them to come and inspect the staff and safety from the infectious disease of COVID-19. What are you going to do to hold nursing home operators accountable to keep staff safe from this infectious disease like COVID-19?
Thank you so much, Francine. Appreciate your question. And I want to let folks know that Francine has been a COVID long hauler. She's still at home. And she has also lost her mother to COVID-19 because she brought the infection home. And we really appreciate your strength and will to be here in honor of your coworkers and yourself. Thank you, Francine. I'd like to now invite Gerardo Reyes Chavez, who is a farm worker and organizer with the Coalition of Immokalee Workers, who also has a question for you, Jim. Gerardo, are you there?
Yes. I don't know if you can hear me. Thank you so much for the invitation to share. I'm Gerardo Reyes Chavez with the Coalition of Immokalee Workers, a farm worker human rights organization based in Florida. I have picked tomatoes, oranges, watermelons in Florida, Georgia, Missouri. Since I joined the coalition, started to participate in 1999, we have campaigned for, won, and implemented the Fair Food Program, internationally recognized as the gold standard in social responsibility programs. The program, which received a presidential medal from the Obama-Biden administration, leverages the market power of large retail food corporations, food buyers like Whole Foods, Walmart, just to give a few examples, to enforce compliance with human rights code of conduct on participating farms. Farms who don't or won't comply lose the right to sell to the program's 14 participating buyers. Most of the CIW's code of conduct can be boiled down to one simple command: follow the laws in the book. The problem is, in US agriculture, violating farm workers' legal rights is the norm, not the exception. But inside the Fair Food Program, things are different. Workers have the right to make complaints on the 24/7 hotline and are protected from retaliation whenever they do. Over the past 10 years, the Fair Food Program has virtually eliminated abuses from sexual harassment to slavery. It also includes the only enforceable COVID-19 protections for farm workers that we have seen in social responsibility. And as a result, farms in the program have avoided the types of major outbreaks of COVID-19 we have seen on farms elsewhere in the country, where most farm workers are not covered by any mandatory 19 rules at the state or federal level. But there is one issue where the Fair Food Program and all farm workers need OSHA's help more than any other: heat stress. Rising temperatures due to climate change have had a gruesome impact on farm workers in construction, farm work, and other types of jobs outside. And people who work outside in America disproportionately come from marginalized communities. Yet, after nearly a decade of petition from workers' advocates, there's still no federal heat stress standard. And most states lack one too, including Florida, where we are. One of the largest states for both farm work and new construction going on, and where the CIW is based. In the Fair Food Program, our code of conduct already guarantees some common sense, the transformative protections against heat that are sadly absent on many farms outside the program. The right to take rest breaks, mandatory shade structures, access to drinking water, and the right to take a break whenever our work feels unsafe. But heat stress is a medical issue that also requires detailed technical standards, the type of science-based, across-the-board regulation that only OSHA can provide. And if OSHA were to finally provide it, rest assured that in participating farms under the Fair Food Program, we could and would enforce it. I want to tell you one story so that you understand what is at stake here and for everyone. Last summer, the CIW received a call from a worker at a farm that used to be in the Fair Food Program, but did not comply with the code and left the program because they didn't want to have to respect the workers and make sure they were safe. The caller wanted to file a complaint because workers were not being allowed to take breaks when they requested them due to heat. The CIW had to explain that because the farm was not in the Fair Food Program, the only resource in that instance was OSHA, and provided the OSHA phone number. 1 week later, the same farm worker called the CIW again, this time to report that one of his coworkers had died of heat stroke. The call was not answered. These stories are only going to become more and more common because workers feel more and more pressure to pick as much as they can, especially workers under H-2A. That is a program under rapid expansion which mandates a higher hourly wage. Higher wages are a good thing, but employers are asking their workers to make it up through increased productivity, pushing them to their limits, up to the depth. That's what we need to also be paying attention to, life and death. And that is really what is at stake here. With summer now officially here and temperatures rising to record levels, every day that OSHA delays issuing and enforcing an emergency heat stress standard, more workers will die. OSHA recently issued a request for information about a rule that you were mentioning earlier, but this slow approach is not enough. We need to do better. An emergency rule is needed immediately. Will you be able to work on trying to issue one? Because if we were to have that, we could do a lot more in 90% of the industry, of the tomato industry, that is part of the Fair Food Program to protect workers, while we try to expand those provisions, those protections to other places. Thank you very much.
Great. So again, thank you both, Gerardo and Francine, for those for that information and your questions. And Francine, my heart goes out to the experience that you have had both at work and as well as in your personal life over the prior 15 months here. And I just, can't thank you enough for what you have done at work as well as at home to do the best as possible. Just a couple of things on the COVID front, and specifically for a nursing home setting. The new emergency temporary standard from OSHA is definitely helpful for the workplace that you've described, and we want to make certain that all of us at OSHA in any of the areas of the country are working with workers in healthcare to understand where problems still exist. If you have issues, if you have concerns, please reach out, contact OSHA. Filing an OSHA complaint when necessary is something that we want to be responsive to. We, since January, we have issued multiple pieces of guidance for many different workplaces. We also have already talked about the emergency temporary standard, but one item that we hadn't discussed yet this afternoon is the national emphasis program that OSHA issued in March for COVID-19. And a national emphasis program is a little bit of weedy OSHA speak, but it essentially helps OSHA prioritize workplaces and hazards associated with COVID-19 to make certain that our enforcement efforts, both through the complaints that we get from workers, but also through the inspections that we make without complaints, are focused on those workplaces where COVID-19 hazards exist. And our effort is to try to target those workplaces that are putting the most workers at the highest risk, and also workplaces where retaliation is a concern and a problem pertaining to COVID-19 protections. And so we truly want to continue to work with all workers to understand where COVID hazards remain, where protections are not adequate, and we are being as responsive as possible to OSHA complaints. And OSHA is here and available to be responsive to you, Francine, and other workers with concerns at your workplace that are happening and they're continuing to happen today. And then pertaining to the heat stress issue, there are a number of things that we are putting in motion. The request for information is one important piece in the process that it will take to lead to a permanent rule on heat, indoor and outdoor heat. But again, you are spot on. This is a long process to create an OSHA standard. Both in my prior work as well as in my current work, I recognize the time that it takes for OSHA to issue a rule. I understand much of the nuance of why that is now better than I did 6 months ago. But this is not to make an excuse for the time. It is just to express the process. So in the interim, there are a number of other things that OSHA is doing. We are working on other education materials materials will both be available in English and Spanish on heat issues. We want to make certain that we are working with workers and employers to understand where good practices have been in place so we can learn from that and try to utilize that. We also need to recognize and understand where problems exist and be responsive to those, again, through OSHA complaints or other means, to make certain that we are helping workers today and doing everything that we are able to do through outreach in a proactive sense, through response of complaints and enforcement when it's necessary, and also to build to the point that we can put together that the material that's necessary to work toward a rule for workplace heat stress issues.
Thank you, Jim, Gerardo, and Francine. I want to make sure we continue and give other folks an opportunity here. I'd like to now invite Jessica, I think I'm pronouncing this right, Stay Sanchez, or Steve, who is an Amazon worker. She's a leader at United for Respect, who's a partner in the Always Essential. Jessica, are you there?
I am, thank you.
Great.
Thanks for inviting me to share my experience with you today. My name is Straya Sanchez.
Yeah.
I live in Denver, Colorado, and for 2 years I worked at Den 2, which is an Amazon warehouse in Aurora. I now organize at United for Respect. At Amazon, I worked in pick, dock, the spur lines, and other random jobs. Amazon is an exhausting place to work that leaves our bodies broken, and it shouldn't be like that. Many of our colleagues have had injured backs, knees, wrists, and other body issues just from working at Amazon. And recently a Spanish-speaking friend of mine was injured, and Amazon tried to get her to sign a paper that said she wasn't responsible for her injury. She caught it, but they tried to pull a fast one on her, thinking she wouldn't know any better, and sign it. On June 28th, 2019, I was driving through an aisle on my pit and had 5 huge heavy boxes fall on me. And I was told by safety, this is a large operation and we're not going to shut down to fix this. I also had disc brakes fall on my foot from an overstuffed bin that sent me to AmCare, where they told me that how my accident happened numerous times, trying to convince me it didn't happen the way I said. They played a lot of games with me that day, and nearly everyone I talk to goes through the same when they end up in AmCare with an injury. The numbers speak for themselves. Last year, Amazon had over 20,000 reported COVID cases, 37 complaints of worker retaliation to the National Labor Relations Board, and over 24,000 serious injuries. Amazon has twice as many injuries as other warehouses. Those injuries are because Amazon constantly squeezes employees to move faster and faster. Amazon's quota or rate, constant monitoring every second, and threats of being fired create a high pressure situation that leads to injuries. This isn't a problem of mismanagement in individual warehouses. It's Amazon's backbreaking system that's the problem. These problems at Amazon are not new, and action needs to be taken. There need to be rules and regulations in place to ensure Amazon employees are not getting injured on the job. So since Amazon clearly can't regulate themselves, the real question is, what is OSHA going to do to hold accountable for its injuries? And more generally, what is OSHA going to do to catch up to these new higher tech business models that monitor, track, and pressure workers? Thank you.
Thank you, Straya, for your commentary and question. I'm going to now invite Holly Shaw, who's a family member and an activist for both Philip Posh and National Kosh, as well as a member of USMWF. Holly?
Hi, my name is Holly Shaw Hollis. My husband, Scott Shaw, was killed in 2002 when he fell off of 2 tires that were connecting 2 barges together while his company was assisting in dredging in the Schuylkill River. His company did not ensure there was life-saving equipment worn or available, which would have most likely saved his life. I had never had occasion to work with OSHA at this point in my life. I honestly had never even thought about the concept of safety at work. I was a Philadelphia school teacher and had never had to deal with OSHA at the time. When Scott's accident happened, the experience was brand new to me. This is not rare with family members of those injured or killed at work. I was lucky. The Philadelphia area OSHA kept me updated via letters regarding their investigation, as well as their conclusions and fines levied at the company. As I have become more involved as an advocate for safety in the workplace, and as I have gotten to know more family members and their stories, I have found that OSHA's contact with family members is inconsistent throughout the US. USMWF, which is United Support and Memorial for Workplace Fatalities, a national family group. I lost my place, sorry. And the COSH groups have worked with regional OSHAs to respond better to families as they navigate the process. One thing that my OSHA office did not do, and I didn't know could happen, was that the company could negotiate the fines down. Scott's company did, and they ended up paying much less than they were originally fined. So my questions. First, along with the very recent changes that ensures that OSHA communicates with USMWF and family members quarterly, what short and long-term goals does OSHA have to continue to work with families to help them understand the negotiation process, as well as give them a voice in any negotiations and keep them updated in real time of the steps being taken, negotiating fines, as well as the investigation into their loved one's injury or death? And second, how will OSHA ensure that the regional offices are all being consistent and transparent as they work with families, as well as helping families understand exactly what is happening with OSHA and their loved one's workplace? Thank you.
Again, thank you both, Holly and Jessica, for your information. And again, Holly, very, very sorry for your loss. And to perhaps start with your questions, Holly, as you know, or I think you alluded to, OSHA and USMWF, we met just recently, sometime in the last few weeks. Sorry, kind of forgotten exactly the date. And we are planning to meet periodically, regularly, and continue a conversation. It is very important that we continue to hear about the places and the events where things have not gone as planned. And certainly the organization does just incredible work. And we at OSHA will continue to do work with USMWF and others that advocate for the voice of people who have been lost at work. We have also shared information and will continue to share information from that. We pulled some of our regional administrators into that initial meeting, and we'll continue to do that moving forward to help bridge any miscommunications that have been occurring. We want to make certain that we're doing this as consistently as possible. And these are challenges that we have to better address moving forward to make certain that the consistency is better, and we'll continue to strive for that. We also, as part of that, and this is within the OSHA family, this is part of our ongoing conversations, is to be only consistent in how and when we communicate with families of victims of workplace fatalities, but also the content. And so the OSHA process and what transpires is important to share in that. And again, we need to continue to work on that, but also to receive the feedback of knowing where we have stumbled so that we can make sure that we do better moving forward. These are difficult investigations for the staff at OSHA that deals with them. They're horrific events that take place to the family and the community and the coworkers. And again, my heart goes out to everyone who has been a victim of a family member being killed at work, as well as those who have died from long-term occupational illnesses and catastrophic injuries as well. So we certainly are totally committed to try to continue that process, building the relationships at our regional office levels with all sorts of advocacy groups, COSH groups, victims, families groups, and others. So we'll continue to do that work. And then Jessica, specifically to your question of holding employers accountable to the regulations that OSHA enforces, it is vital for any employer. Any employer, it is necessary to make certain that we have the resources that we need to do that. And you know, we have the resources that are allocated through our budget to do so. We are very fortunate of late that those resources have been, we've had some increases made available to us to bring more staff onto the OSHA ranks specifically in compliance officer roles, so that there are more people, boots on the ground from OSHA in the area offices, able to be responsive to concerns and complaints. One of the very important parts of this process is to make certain that when there are concerns in a workplace that can't be addressed or resolved within the facility, and OSHA is a needed part of that process, that when the complaint comes into OSHA, that you know, the complaint itself provides the right information so that we are able to be responsive properly. And you know, I certainly know that's one of the very
for the simple fact he was able to go.
The very important parts of the KOSH organization, and specifically, you know, the KOSH conferences that take place annually toward the end of the year, where workers and worker advocate groups learn how to properly file an OSHA complaint so that we do get the information that we need to make the right response and get the right staff from OSHA engaged and involved and out to the workplaces. And so this is, you know, I see this as much more of a matter of our responsibility, our mission is to make certain that all employers are following the rules that they're required to, and to, you know, all of us recognize that OSHA rules are the minimum requirements, and we want to see every employer go well above and beyond the minimum requirements and provide much more effective health and safety protections to all workers in this country.
Thank you, Jim, for that follow-up, and thank you, Holly and Jessica, for your comments. I will now open it up to Jaribu Hill. Jaribu serves as the Executive Director for the Mississippi Worker Center for Human Rights, and she also sits on the National KOSH Board. Jaribu, welcome.
You, Jessica. Thank you, Jessica. Hello to Jim, Marcy, National KOSH, the board, and all of you comrades in workers' rights struggles. So glad to be a part of this conversation. I would be remiss if I didn't express on behalf of so many workers here in the Mississippi Delta who are Black and brown essential workers who are low wage, many of whom are temp workers who work in places that are totally unregulated, our profound disappointment in the limited scope of the emergency temporary standard. So that's the first thing I wanted to make sure that you understand, that we actually hope that there will be some reconsideration with regard to those who are uncovered. Today, I want to just ask a question for the most vulnerable regarding the right to refuse. For all these years that I've been involved as an advocate in health and safety, it's been a gray area. It's been an area that's not been clear as to what protections are afforded workers when they refuse to work in dangerous situations, when they refuse to do dangerous work, life-threatening work. What is the current law under OSHA regarding the right to refuse, and how do workers access information about that right?
Thank you, Jaribu, for your comment and question. I'm now going to also invite Eric Sanchez from We Count. Is Eric with us today? Hi, Eric.
Sí. Buenas tardes.
Buenas tardes, Eric.
Buenas tardes. Mi nombre es Eric Sánchez.
Good evening. My name is Eric Sanchez, and I'm here from We Count in Florida. And someone already spoke a lot about the high heat index, and we work with a lot of day workers and construction and farm workers. And as the other brother said, there's no protection against high heat or heat exposure. So how is OSHA going to guarantee that these workers have that basic protection for shade, for health, water, breaks, that is currently not being provided, and that many of the workers have died because of it, or have been, their lives and health have been impacted by it, by not having these basic measures. Thank you.
Great. So again, both Eric and Chair Booth, thank you for your comments. And let me start by Eric reiterating a couple of things around the heat stress issue. We specifically added the heat rule to OSHA's and the Department of Labor's regulatory agenda because of the situations that you just outlined. And thank you again for outlining that. There are far too many workplaces where the controls that you mentioned of shade, water, breaks are not readily available to workers. And again, we want to work with employers. We want to work with workers. We want to make certain that we're continuing to educate people about the hazards associated with heat in the workplace, so that we improve the conditions at workplaces. Again, our goal is to work toward the process of a regulation in place, but as we've heard from some of the other speakers this afternoon, not every OSHA rule that is in place is necessarily followed to the letter by every employer, and so it's also about making sure we educate and recognize the importance of those controls as we move forward. And I think we recognize, you all recognize that the hazards associated with heat are worse this year than they were previously, and be worse next year than they are this year. And so we need to work on this as diligently as possible as we go through the process to get to a point that we can have the protections into a regulation, a permanent regulation at some point in the future. So, we will continue to do those things. And I'd ask that everyone, please, take a look at some of our revamped materials, educational materials, and outreach materials that are available on the OSHA website, and provide us with the feedback of what is helpful, what's useful to share with your coworkers and members of your organizations, what's useful to share with employers. And again, when there are problems that can't be resolved, OSHA is also here as an enforcement agency to be responsive to worker concerns through OSHA complaints. And we will work with folks on those matters. Pertaining to the right to refuse unsafe work, I actually have asked one of my colleagues from OSHA, who is on the phone, is our senior policy advisor, Ann Rosenthal, and I asked if Ann might take Jerbu, your question, and give us a couple of thoughts. If Ann could unmute and speak for just a couple of minutes on that.
Sure, I would be happy to. Hi, Jerbu, and I'm really sorry for what you have gone through also. OSHA does have a regulation that implements the law that does say that workers have a right to refuse to work, but it is extremely limited. As you know, it applies only if workers have a fear of immediate serious harm and they don't have time to try to get their employer to fix it or to contact OSHA and get an inspection to occur before they would have to work. For some kinds of hazards, this is adequate. The case that affirmed this involved workers who were told to walk out on a piece of mesh that one of their colleagues had fallen through and died 10 days earlier, so it seemed pretty obvious, even to the Supreme Court at the time, that this was very safe. But the whistleblower provisions and right to work provisions in the OSHA Act, I will say, to my great sorrow, are among the weakest of any statutes. There is a right, but it is a very limited right. To the extent that you know about hazards, we strongly encourage you to make a complaint to OSHA about the hazards. To the extent you can do that anonymously or have your identity protected, that is one way to get OSHA to come out and do it. But there again, we are faced with the fact that OSHA does not get the resources that it needs. I mean, we have a lot more this year because of the American Rescue Plan, but it's taking a lot of time to hire all the inspectors that we need to get out and actually inspect plants. I would love to be able to tell you, as I'm sure Jim would, that we have the ability to fix a lot of these problems. The bottom line is that we don't. The statute needs to be strengthened in several ways. I would encourage everybody who can vote to go and talk to your Congress people, vote for them, the ones that will make changes. And in the meantime, to continue holding our feet to the fire, because that's really what can work best. If you are contemplating a work refusal, I would urge you to seek counsel from me. I know you are a board member, I guess, of the Mississippi Workers Center, and I don't know if you have lawyers affiliated with you. If you do, talk to them. Try to make sure you have all the ducks in a row. I'm sorry, you're answering, but
I'm a lawyer.
You are,
and I'm
okay.
the founder of the Workers Center.
All right. So and contact us, and you can contact me if you want any more detail that I can give you. I actually worked with an organization called OSH Law to issue a whistleblower toolbox about 2 years ago, and I'll send you that. You can write to me just at OSHA. My email is rosenthal.ann@osha.gov, and I'll be happy to send it to you.
Jessica, you're unmuted.
Yes.
Okay. Hi, everyone. Can you hear me now?
Oh,
Yes.
All right, thank you. So what I was saying, just to reiterate, is that we are collecting questions from the chat, and we'll make sure that we collect those, send them to Jim, and share them. We understand that we have a very limited time. So I want to move right into one last question from the chat, and then Jim, maybe ask you to respond and move on to final remarks. So Susie, who's part of our national COSH team, has been moderating this chat and has sent me a question. The question is, how is OSHA going to make sure that state plans adopt the ETS within 30 days? And I'm going to give you a chance to respond. There's a lot of questions regarding the ETS. One followed with, how will the NEP on COVID, which does target various different industries, interface with the current ETS COVID, which is limited to healthcare? So Jim, if you could respond and maybe move on to final remarks.
Sure. So the National Emphasis Program, the NEP that Jessica referred to, is, again, very wonky OSHA speak of how we help prioritize where our resources in enforcement will be focused. And we're continuing to move forward. We're refining this a bit, making certain that we have tooled this to be reflective of the ETS in place, and making some other adjustments, and continuing to do the work on the enforcement again, recognizing that we also will be responsive to complaints that are filed specifically related to the ETS or related to workplaces that are not within the healthcare sector, and OSHA will continue to be responsive where there are hazards and controls are not in place to protect workers. And then flipping over to the specific question on the state plans, and again, with the number of state plans, we initiated dialogue and conversation with the state plans throughout this process that OSHA has gone through, and we are continuing that dialogue to make certain that we are one, making the understanding known that the 30-day time window is now active. The publication date of the standard was this past Monday. It was in the Federal Register, so the publication date was this past Monday. And we are moving forward, working with our state plan partners to ensure that we're responsive to questions, providing clarification, understanding what may be in place in some states already, and to help with the recognition and understanding of what is at least as effective as, and we're in that process now to make certain that we do meet that 30-day time limit. So with that, just as I know we are very short on time, so just with a couple of closing thoughts. First and foremost is an incredible thanks to the 200 plus people that were on this call today. Thank you all very much for what you are doing in your workplace with other workers that you're working with, and making workplaces safer across this country. It is vital work, and we recognize that and understand that. Jessica, again, we totally recognize that there have been a number of questions in the chat. I've specifically not been trying to read them because I was starting to read them and being distracted, and I did not want to be distracted from the conversation going on. But I understand that you all have captured them and will share them with us, and we will be as responsive as possible to those with the National COSH folks, as in a timely manner, and get that back at some point in the near future. And so just again, the thanks to everyone that participated today, and specifically, the thanks there. Again, there were quite a few OSHA staff that participated as in the call today. Ann spoke on one matter for us, and others have been on here, both helping us put together the logistics and just participating as part of their work. And again, I can't thank enough the almost 2,000 people that work at OSHA that come to work every day, who have been dealing with both workplace health and safety hazards broadly since the time they started at OSHA, but specifically with the hazards associated with the COVID-19 pandemic in the last 16 months. Everybody who has worked at OSHA during that time period has been engaged and involved in trying to do as best as possible within the scope of the resources that they had available to be responsive to concerns from workers. And we want to make certain that we are giving them additional resources and support so that the responses that they are able to provide are amplified. Just as we want to amplify the voice of workers in health and safety, we want to make certain that the responses that OSHA staff are able to make to all workers pertaining to COVID hazards and other things are amplified, that the resources that they have, the tools in their toolbox are ready, and that they can do the jobs that they come to do every day. It is an incredibly dedicated, well-qualified, committed staff that just, it's an incredible honor for me to have spent the last 5 months and 3 days working with the staff at OSHA. And, I look forward to our continued conversations with National COSH, but also with so many of the folks in the groups that are on the phone today, because we're certain that we are continuing the work that OSHA does across the entire footprint. So I'll turn it back over to y'all for any closing thoughts.
Wonderful. Thank you so much, Jim, for your closing remarks, and again for reiterating the importance of our continued collaboration and dialogue. We did do that favor of capturing those questions via chat, so we're hopeful that we're going to be able to share them with you get your response and share them back with the amazing network that is here today. During the call and your responses, I had the fabulous support of my co-director, Marcy, summarizing some of the commitments and follow-up that I hope that we can move forward in this continued dialogue. And I want to summarize them here so folks understand what we have committed to and what we've heard from Jim. So one is that we will collaborate with COSH to increase and improve communications, and we want to ensure that these spaces continue that mission of language justice and are multilingual. Meet on a regular basis to build trust, address priorities, including priorities that are coming from the national agenda, families, and the USMWF. Follow up on problems related to state plans, ensure that state programs are at least effective as federal OSHA requirements, increase staff to whistleblower programs, resolve cases in a timely manner, progress on strengthening memorandum of understandings or agreements between OSHA, in particular with the Department of Homeland Security, Immigration, and as you mentioned, Jim, also the Food Safety Inspection Service. Progress on addressing heat stress measures, including advancing a standard, develop consistent practices on how to respond to families and engage families, monitor enactment of the emergency temporary standard for healthcare workers federally, but also in state plans. So these are some of the commitments and follow-up that we were able to pull from this town hall. Again, we want to remind folks that this is what we're hoping the first of many dialogues. I think from Jim, we have already received a commitment to meet at some point near Labor Day to continue this discussion. I also want to let folks know some of the resources that National COSH makes available. We are a clearinghouse of resources as well as programming that allows for workers and support for workers in their efforts to organize and build education programs for workers. We have most recently developed a fact sheet with the support of our COSH advisors around a fact sheet with information on the current ETS for healthcare workers. I saw a commentary from my team as well. We are preparing for COSHCon. Jim alluded to COSHCon as a conference where he himself has been present as a facilitator and speaker, that we will be providing that information in the near future as yet another space for us to continue sharing strategies, some of our realities locally, but most importantly, strategizing to support each other's work in spaces to collaborate and be able to push our agenda forward. So I want to thank everyone that's been here today. Gracias a todos que han participado. Estamos muy contentos de su apoyo y participación. Queremos informarles de nuevo, recordarles que COSH está comprometido a seguir adelante con este
diálogo. We want to remind you
diálogo.
one more time that COSH is committed to continue with this dialogue. And what's even more important, I want to emphasize the importance of having our representatives. Thank you.
This program. Bye, everyone. Have a great day.
Gracias.
Adiós.
Thank you.
Thank you.
Gracias a todos.
Gracias a todos.
Thank you, everybody.